Good day, and welcome to session 4 of our seminar series. Today's seminar focuses on digital health in Sub-Saharan Africa. Before I introduce our esteemed presenter, I want to point out that we can see that many people are not able to join the live presentation given the time difference. However, we're heartened by the fact that we're seeing over 300 plus people coming back and reviewing, looking at the sessions. So we know that it's hitting the mark. It's just time zone differences. Our presenter today is Joel Ugborogho. Joel is a technology entrepreneur and executive. He's the founder and CEO of Sen Health, a health technology company that specializes in digital health services and health technology solutions by leveraging emerging technologies, artificial intelligence, Internet of Things, blockchain, mobile apps, and cloud computing. Now, Joel has over 25 years of global experience under his belt in the areas of technology strategy. His skills and expertise have allowed him to thrive in the developed markets of the UK, Europe, and the US, and deliver impact across various industries and emerging economies throughout East, South, and West Africa. His expertise has been garnered across a range of industries, including healthcare, financial services, e-commerce, telecommunications, mining and energy, and global listed companies such as BP Chemicals UK, the government of the UK, Citco Fund Services, KPN, Vodacom, Deloitte, Dell EMC, Anglo-American Standard Bank, and BP South Africa. Joel holds a master's in science, information systems development from the London School of Economics, and a bachelor's in biochemistry. Joel's expertise is uniquely positioned to help us to really think of the whole digital ecosystem for health in Sub-Saharan Africa. And I'm really anxious to hear his perspectives this morning, because as we all know, digital health is often discussed in the language of systems, codes, platforms, and policy frameworks. Yet for practitioners working closest with communities and individuals in care settings, the real question is simple and more urgent. The question is, how does technology improve the daily experience of care, especially for individuals seeking help and the health professionals striving to provide that care? And this care is not just health-specific, emergent care on the ground. It's also the broader complex of health and well-being, awareness, and access and interconnectedness. So I know Joel is an expert in this, and he's done a recent survey, and I'm looking forward to hearing his perspective. Joel, welcome.
Hello, thank you very much, Dr. Yonette Thomas. Thanks for introducing me, and IPSP for the invite, and Urban Health 360. Thank you very much. That was quite a very good introduction. I hope I can live up to it. Interesting. Anyway, so since I've been very well introduced, I wouldn't go over introducing myself. I'm Joel Ugborogho, as Dr. Yonette introduced me, and I'll just get ahead and go through the presentation. So I'll start with the first slide here. I don't know if you could see it, if everyone can see it.
Yeah.
Okay, that's good. So I'll just give you a bit of background to this. So this survey was held last year, November, December, and the whole idea was to actually get the viewpoints of healthcare professionals across Africa. So it was mainly with Sen Health Academy and Sen Health organizations and Urban Health 360, and also Kambo Health Initiative. Okay, so sorry, 1 minute. Yeah, so I will go through just to anchor this presentation so that there's flow. You have access to the full report. The full report is about 34 pages, a lot more detail than what I'm going to talk about now. But what I've done is that I've just created a short agenda to anchor this. So we talk about the report overview. We cover digital infrastructure, digital health value chain, health value rather, capacity analysis, governance and policies. And then the most important bit, or to round everything up, is how do we achieve digital health transformation? Okay. So the report overview. Now, when we set out to do this survey, the broad objective here was to assess the digital health readiness of the healthcare professionals. So note, we're talking here about the healthcare professionals, not the organization itself. Now, the period in which we took out the survey, November, December, maybe not a good time because towards the year end and everybody is quite busy. So we only got about 127 people participating in the survey from about 15 African countries. Top 5 countries were Nigeria, Kenya, Zambia, Uganda, and which other country have I mentioned? Anyway, Zambia, I believe. Okay. And then we had survey constraints in terms of the timing of the survey, in terms of people getting involved. And when we talk about area of health specialization, we had a good response from GPs, doctors, surgeons, pharmacists, laboratory technicians, and allied medical health professionals. Now, obviously, in doing this survey myself, and I had expert contributions from Dr. Yonette Thomas and Dr. Mable Kipenda. Thank you to both of them. Assessing the outcome, assessing the raw data, and trying to make sense of what this whole thing means in terms of what we're trying to achieve. Okay. So 2 key things. Now, we're looking at that survey. When the questions and the questionnaire was designed, it was designed with 2 things in mind. The problem statement, so we're trying to tease out the problem statement, and technology solutions, so that based on what we're getting back, we're able to now look at what sort of solutions can we put in there, what sort of opportunities, and even ask them about opportunities there, efficiencies and things like that. Now, those 2, problem statement, technology solutions, I may come back to that, so bear that in mind, but they all lead into presenting the report along 5 key pillars: the clinical efficacy and workflow, how digital tools work within the context of the healthcare provider. You know, there are various verticals within healthcare providers. How a pharmaceutical will work will be different from how a hospital will work, and that will be different from how a laboratory organization will work. And then we talked about human-centered skills gap, the healthcare professional skill gap in relation to what they need to do their job. Infrastructure resilience, looking at the infrastructure resilience, now that cuts across the board. We're talking about foundational things like servers, interconnectivity, and all that stuff. And then data sovereignty, which has become a hot topic recently, and ethics. Now, within data sovereignty, we're looking at patient privacy, and we're looking at things like ensuring that, okay, how do we ensure we own our data, and the data that we own, we have access to it, and it's actually collected ethically, right? And then interoperability, very, very important interoperability, because without interoperability, you can never achieve scale. So that's one other thing we look into, okay? So infrastructure readiness. Now, as I said, infrastructure has to do with the foundation, right? And when you don't have, when you're building a property, building a house, you have to start with the foundation. Now, the infrastructure readiness, we're talking about the foundation, the digital foundation. So we're talking about things like power, we're talking about servers, we're talking about interconnectivity. So it's interesting because when we look at these 2 pie charts to the left, right, there are 2 key questions we asked, and you can see that the results are almost similar. We asked about reliability of internet or mobile connectivity on the left, and then we asked about power supply. Now, you remember I mentioned earlier about the constraints towards this, because most of the people that responded were either in urban or peri-urban areas. We didn't really have people in rural areas. Having said that, you can see that when we combine reliability, which is 49%, when we're talking about interconnectivity, and 28% of those who said that, okay, is, when we combine those who say it's reliable and very reliable. So 49% combined with 13%, 62 odd percent there. And on the right side, we have almost 59%. You can see that generally, if we say 60% on average, they feel that there was stability. Now there's a lot to build on that. Now let's take into account the question we asked about devices. Now, access to devices is important. And on the right, when we asked about do they have access to device, you can see 44% say they have access to shared device. And that shared device may make sense, especially in a setting where there's a main PC tied to a main application. And then people who had the dedicated access was about 38%, which is also very good. Now, overall, we can see that when it comes to accessibility, there's progress being done there. But now let us look at the constraints. And there was another question we posed to them about the constraints. And when you look at the 5 top constraints that came out, slow internet speed, 70% of people complain about that. And we told them to click the number of, so we're just ranking the top 5, right? Now, we've all experienced this slow connectivity when you're on WhatsApp and you're speaking to somewhere where there's low bandwidth or poor connectivity. So internet speed being slow really disrupts quite a lot of things. Frequent power outages. Now, this can be addressed when I talk about energy solutions coming on board, solar, UPS devices, and all those things. But high data costs is also important to look into, because how do we reduce data costs in relation to the earning power of the healthcare professionals? Then a lack of signal network, that is actually an infrastructure thing, because obviously it depends on how many of the masks and things that we have and access to those sort of things and charging stations. Okay, so that really sets the foundation. So we bear that in mind, that as we go along talking about solutions, we know that without really addressing this and having interim solutions about this, we're fighting a losing battle, so to speak. Okay, so how do we start working on the solutions? Now, to round up the presentation further down, I'm going to talk in more detail on this, but here I just want to highlight from a technology solution perspective. Remember, I talked about the problem statement and the technology solutions. So one of the key things we have to start is, how do we address the digital divide? That's those in the capital urban areas who have intermittent power issues, fragmented telecom infrastructure in comparison with the rural areas, right? So we have to look at what sort of solutions can work there. Digital first approach is an underlying factor. Without a digital first approach, we cannot really, we can't do anything when we're talking about all this digital transformation and, more importantly, AI. So a digital first approach has to be there, followed closely by mobile first solutions. So when we're talking about connectivity, so a mobile first solution, looking at mobile devices, looking at offline interoperability, and then interoperability being mandatory, plug and play systems, yes, a must. But how do we make all these things happen? It comes to execution over innovation. So we really have to reduce the amount of innovative solutions and ideas and things, and be focusing on solutions that will work. And when those solutions work, we have to look at how we scale those solutions. So here I'm going to talk about the digital health value. Now, with the digital health value, is from the perspective of the healthcare professional, how they see the value of digital health technologies in terms of their everyday working life. And this slide I'm going to go through is exactly as it is in the report, and it looks at a number of questions we posed to them, right, which are the pie charts you see to your right. But the key output of this is that what we were able to pick from this was there's a digital infrastructure resilience that has to be addressed, right? So you cannot have where sometimes it's working well and people are excited, and after it does not work and then they're up and down. You don't have the consistency. Once you start having pockets and gaps of data in various formats and things like that, then you're actually having a situation where you're losing the battle slowly. The next is specialized technical training. Now, people have to be trained in relation to not necessarily only the job they're doing, they have to be trained in two levels. Overall, to understand the big picture, awareness kind of training, and then also specialized training and role-based training. So that comes into play. So if we just quickly go through the pie charts that we have there, a question we asked was familiarity with digital health technologies. Now you can see that is very good results there. Many people, 40% say they're very familiar. 31% say they're moderately familiar. That gives us 71% combination. Okay. But then when you now look at the slide next, the pie chart next to it on the right, the extent of digital health use of the extent of digital health technology use, right? Rather, you find out that although they know about this and they are familiar, but how often is it used? So you can see now that extensively 23% I have there, and then moderately 34%. So it's not that high, okay? But they're aware, so there's a willingness to use that. And then when we now actually try to explore what their views are regarding the impact of digital health in public health, extremely impactful is what 27% believed, and a good 57% believe that is very impactful. So that's very high percentage. We're looking at 84% believes in that. And then the importance of digital health training. Now, extremely important, 49%, very important. Combine the two, you're looking at 95% importance in digital health training. So what's coming up more and more is a gap in training, and a gap in training in relation to what they're doing. And also you're looking at training from the perspective of if you're selecting solutions, because there's so many solutions out there, it's a very big market. What solutions do we bring on board? Okay. Now, this slide looks at or tries to address the question of the benefits to the patient. So we're talking about patient-centric care. Now, there are various solutions out there that could address each of those verticals that are in that histogram, right? So you find out that when we look and we focus on the red bars and the orange bars, the considerable and substantial, you find out that in the view of the healthcare professionals, they feel there's a substantial benefit when it comes to chronic disease management. That was the highest, followed closely by health assessment and monitoring. And you know that with health assessment and monitoring, one of the things climbing now is remote patient monitoring. So that's a good plus. Now, if we go towards the left side of this graph, you're looking at patient engagement, patient registration, which are the admin related front end, which we can call a digital front door into the healthcare system. Is quite important there, right? And the fee is considerable. But what is interesting here is that when we look across the board, all these verticals are very important: referral management, value-based care, NCDs, telemedicine. Telemedicine wasn't rated as high. I wonder why. But having said that, we have to look at a phased approach, a prioritized approach onto which ones create us to get people in and build to scale, right? So these were their views on the impact of digital health technologies for their patients. Okay. Now we talk about opportunities. You remember I talked about technology solutions, opportunities, efficiencies, and benefits. So now we will talk about opportunities. So the question posed here was the 3 opportunities. They should select their top 3. Now, digital health research and skills was selected as one of the top 3. It's actually the top there, closely followed by best practice and guidelines, and then medical research and development. Now, that tells me that they need access into more medical research and development. But also, if we address medical research and development, guess what? We're creating the opportunity to start developing our own large language models, getting those things in there, best practice, getting that in there, having the opportunity to have our own data on the continent, which we can train on. So it's very good things, but obviously training is important. Understanding of how these data things are used is very important. Regulations and compliance comes in quite high, 33%, which is, I'll talk about governance pretty soon, and you see how that makes sense. And clinical decision making, 33%, which is obviously very important, because if we have that clinical decision making support systems, which are actually very useful and are being used, is something that will make a major difference. Okay. Excuse me. Okay, so the benefits. Now, we asked about the benefits. Now, in their own opinion, what are the greatest benefits to digital health technologies? Now, the top one was improved data collection and analysis, which is very good. And it works across the board for every healthcare vertical. It works across the board for every healthcare professional, understanding the impact of the data they've collected, analysis, and that really helps to improve things. And then we talked about efficiency, increased efficiency in public health operations, which we have here, and better public health surveillance and early warning systems. So when we look at the benefits are over, they're very, very strong benefits, which actually help to buttress and support any business case to actually implement digital health technologies. Okay. Now, we talked about digital maturity levels. Now, I'll explain the digital maturity levels because one of the key things here is that while we looked at this, was we wanted to get an understanding of how mature the environment is before we actually put that in. Now, this was not a direct question posed to them, but this was something we're able to tease out from the various questions. Now, in this presentation, I'm just covering a few of the questions. If you look at the full report, we have over 30 odd questions, or 30 something, almost 40, right? So there's quite a lot. But with this, what did we want to get? You will find out that depending on the digital maturity of the organization they're working in, be it private or public sector, it makes a difference in how they actually adopt digital health technologies. So you find that those in the private sector tend to adopt it faster compared with the public sector. Also, when you're looking at things like EMR, EHRs, the private sector is highest market driven and the public sector is donor funded. Telemedicine, similar, we're having so many pilots in rural, they're not scaling, but in the private sector it's urban and widespread. But AI scribes is strong in the private sector, but low in the public sector. But why is all this important? It just tells you where funding is, what the backend is, the maturity level of the organization actually impacts the maturity level and the skills gap of the healthcare professional. And then we looked at wearables. The reason why we looked at wearables, people talk about wearables a lot and it makes a major difference, but there's limitation based on data costs, especially in Africa. And then also there's a lot of challenges in implementing it at scale. We talk about stabilizing technologies like cloud computing and edge computing, which comes to play, right? And then we have cybersecurity threats as well. So those are things we have to bear in mind, okay? So I'll speed up because I think we have 1 hour and I'm getting almost to half past, so I'll try and speed up a bit here. Now, two technologies that are showing strongly across the board, and that's no surprise, is EMRs and telehealth usage, right? So we find quite a lot of people are using EMRs or EHRs, but mainly in private sector, I hasten to add, is slowly building in public sector. Telemedicine, you can see, is a very interesting slide we have here where 36% say yes and some are saying no. But I mentioned earlier about wearables. Now, wearables is in the same category as the frontier innovations like AI, VR, and AR, virtual reality, augmented reality. Those also make use of those cloud and edge computing technologies, right? So that is also a challenge generally, but there's quite a lot of scope for things to change there. In this, we're trying to understand training, and I'll go through this slide very, very quickly, right? What sort of training will help them most? Now, most people prefer in-person training. That could be historical. Most people prefer that to online training. And also from our own experience, because we run online training and training software, we find that we have to do a lot more of pushing and gearing of focus on demand training for people compared to in-person training, and instructor-led training actually does well. So, and then people need continuous technical support. And then we also look at people having issues with better integration between different systems or different applications. So For instance, here, that's what it's talking about, better integration between different applications and systems. So you find out that if you're using one system and you have to log out and log into another one, if there's better integration and flow, it will be better. So that's is a bigger picture kind of thing, okay? Governance and policies, very interesting sector. I've been talking a lot about AI governance of late, and I've been writing quite extensively. Those who are connected with me on LinkedIn will see most of the things I write about. And when we're looking at AI governance and policies, yes, we could be working in the isolation with senior management and leadership in isolation, but in this case, I'm posing the question to the workforce. How many of them, a simple question, how many of them are aware of the digital health strategy for their specific country? And I said African country because this whole thing is focused on Africa. 45% said yes, 55% said no. Now we only have 127 now. I think if we do on a wider scale, we get much more interested. Then it would be nice to do something on governance and policies further down the line. But it just tells you that the awareness is not really strongly there. But add on to that, we go to another level. Let's talk about interoperability standards. Now, most people are not really aware of standards, or at least those who are aware tend to be senior management, but we're talking about on the broader level. Now, fair enough, they may not understand the details of our standards and they're not expected to, but it's just the awareness and the principle. So when we're talking about standards, interoperability, and health information exchange, the open standards being adopted is important, especially in the healthcare sector when we're talking about HL7, we're talking about FHIR and DIACOM. And then we're looking at open APIs, a plug and play situation, and interoperability is important. So when you now pose the question on the right, when you say, do you have access to the governance information or policies within your own African country? 32% say yes. A higher percentage say no. Now, obviously, that relates to their role in the organization and what they're doing. So it's not really a clear-cut thing. But having said that, I think when we're looking at middle management across the workforce, they must be aware of certain things. So the training is not necessarily, when we're looking at the workforce training, we're looking at role-based, we're looking at layers-based and the impact they're making in the organization. And then the pie chart on the left talks about knowledge of digital health strategies from non-African countries. So how many of them know about, just based on their own personal information, based on their connections, the people they follow on LinkedIn, people they follow online and whatever. And you find out that 1 being low, 5 being high, 39% they are the level 3 that feel they know, and 25% at level 2. So it's not that high, okay? So equity and policy. Now, I spoke about the digital divide earlier. That's something that we have to try and closing the digital divide. We spoke about data as public good, which is very important. So we have to have ethical frameworks to transfer raw data to actionable insights. So you can see that it's interesting because when we look at community trust in digital health, the pie chart to the right, 15% says they trust it completely, and 52% say they're open but hesitant. So when we're looking at the community trusting digital health, and community, the healthcare professional is looking at the community, their healthcare population they're using digital health on, they feel that there's that trust element. So you're looking at two users here, the end user being the healthcare professional interfacing with the patient in the population. So that's what that community trust in digital health relates to. And then the pie chart on the bottom talking about data privacy concern level. You can see that they're very concerned, 68%, which shows you that there's quite a lot of concern there, right? So there's work to be done there. But how do we address all these things? It comes back to leadership training. Leadership training, very critical. Literacy programs for health ministry officials and hospital boards. We're looking at data sovereignty and localization, especially to address data privacy concerns. And also one of the things I didn't put in here, but it's very important, anonymization of data where relevant, especially relevant when you're sharing data. The whole criteria and formats regarding how data is used. And then algorithmic accountability, very important, especially in the era of AI. And that's why when we talk about AI development, you always have to have an ethics consultant and AI ethics person to ground the project, and you're looking at how that whole thing works together. Strategic imperatives. So this is my last couple of slides. I think I have just about 3 slides and I'll round it up here. And I'm going to talk about 6 strategic imperatives for digital health transformation. So in this situation, I'm talking about execution. You remember when I started off, I said execution is the most important thing to make things go. We can talk till whenever, but if we're not really executing and making things happen, then we're not really moving anything forward. So just before I talk about those 6 key things, I found this slide of interest, and what the attention I want to draw here is 2 questions we posed to them. First question being, how important is it for digital health solutions to be developed by your local innovators rather than foreign companies? You can see how very important 63% said and important 31%. So you're looking at an astounding 94% wanting it to be developed by themselves. That's very good and very important, and it shows that we're working closer to the solution. So when you're looking at us leveraging this, there's an opportunity to be running focused workshops, focused solutions, look at hackathons that the young population are doing, because you have the young professionals who are actually really passionate about developing these solutions, and then now look at how can these solutions scale. But most importantly, these solutions must be developed to global standards, because when solutions work in Africa, it will actually also work in other low-income middle countries besides Africa. So there's also the opportunity to export our talent outside the continent. And then the other question we pose is, how successful has pilot projects been in your organization? And when you look at that, it's almost 1/3, 31% says successfully implemented, partial but poor 34%, and then when we combine partial, short use, and no projects done, that gives us 14 and 18%, 32%. So it's almost 1/3, 1/3, 1/3 all the way. So there's a lot of work to be done, but I'm not a fan of pilots in isolation. Pilots have to be thought through properly. They have to be intentional, and intentional by that I mean you have to be planning pilots to scale. So let me bring this whole thing home with its 6 points. So I'll just talk quickly through this. First one, healthcare leadership. That's the anchor. When the leadership is on board and it's from the top, everything changes, the tone changes, it affects work culture. And so we're talking about executive leadership playing a critical role in defining, giving clear digital vision, aligning with organizational strategy. And so what does that bring? We're looking at evidence-based leadership, because the data shows you what is working. It's data-driven. We're talking about digital champions, middle management, senior management, championing and pushing on this. We're talking about advocating for interoperability. If you're not having things interoperable, following open data standards, HL7, FHIR, DICOM is a no-go. And then prioritizing off-first functionality, especially in Africa, because when we design a solution that works in urban, we have to design in mind for the rural areas. So it doesn't necessarily have to be a very different solution. Maybe the workflow slightly varies, but the whole solution is to fit in together. And then that brings us now to governance and regulatory framework, which underpins things, right? I talked about data standards, and when we talk about regulatory frameworks, when we look at AI programs in particular, and this is something I recently wrote about, we're looking at cross-governance integration. And why is that important for AI? Because within AI, people look at it as a standalone, but it's a multi-connected solution, right? Technology. So you're not having the cyber risk, which cyber governance, you're not having the data governance, which is a different area together. Then you now have the integration, right? So there's quite a lot of things that you have to look at about when you're talking about AI programs, which we're talking about. But if you put everything in perspective, the various regulatory frameworks, including finance, then you start making progress. Interoperability and scalability. I spoke about the pilot, so I won't go over this, and I think we've spoken about that quite a bit. That's quite important. I'll just talk to the last slide. On this slide, we're looking at human-centered design. Now, that makes a game changer, because if you're working with developing on this, designing and developing and then implementing solutions that does not or is in conflict with the workflow, you're not really going to get the adoption at scale. So when we're looking at workflow integration, we have to ensure that our solutions integrate with the workflow. But first, we have to check if that workflow is relevant and makes sense. So you have to improve that workflow before, of course, having the technology. So you don't want to now implement technology on inefficient workflows. So there's quite a lot to unpack there. So a quick example, if we look at this, look at a UX designer. If the AI Insight requires navigating 3 extra screens on an EMR, then you're adding extra work, and the doctor may not want to use it because you're actually making it now much more. But if you can do that, it flows within it. It's a no-brainer for them. So that's one. And then when we talk about workforce training and digital upskilling, we have to build a digital health workforce. So it's a digital first, hybrid training models where we move away from one-off workshops. We're looking at peer-to-peer shadowing programs. We're looking at integrated programs, not just what normally happens in the past. And then, I talked about AR and VR is coming into healthcare, not only for training in the surgical area, which is advanced medicine, but also you could use that in training in other areas as well. Okay. And then data interpretation and skills. And then finally, when we talk about change management and digital transformation, a multi-pronged approach is important, but more importantly, when you're tying your target operating model to your overall digital health strategy, you're having an interim operating model phased approach to deliver this. So I believe that all the technology and the skill set and the methodologies and frameworks are present, and we have them on the continent or in the diaspora, because we have people in the diaspora who actually took part in the survey from UK and Canada. The key thing is execution with intent and execution at scale. So I'll pause for now, and that's my presentation. Thank you so much for listening to me, and thanks for the
So thank you, Joel. Stay before I bring on, I see Dr. Mable Kipenda, who you mentioned, collaborated with you on the survey, is in the audience. Before I bring her on, I also want to recognize that Dr. Imidizayo Eberemi Okay in Nigeria, she's in clinic, but listening in, because this is an area that's of particular importance. So I just want to call her out. Dr. Dio is a consultant physician and senior lecturer and the acting dean of the School of Clinical Medicine at Ugborogho University. I hope I got that right, that pronunciation.
Yeah,
Ugborogho, right. Before we go, and I want to, as we go into the discussion, to stay with that, this last slide that you had there with those key areas. I want to, and before I bring Dr. Mable on stage, we've been having, you mentioned some key things: community health, human-centered design, and the whole issue of infrastructure and governance, which is critical for there are 52 African countries on the continent. Different countries are tackling it different ways. I know Dr. Mable can talk about what's happening in Zambia with the Lusaka agenda. Different things are happening in Kenya and across Kenya. Different countries have different elements of this going, but in large part, there is an issue of connectivity and interoperability. So I want us to come back to that. But before we go further, a friend of our work group, Jose Luis Castro, who is the WHO Director General Special Envoy for Chronic Respiratory Diseases, and is better known as the founder and ex-CEO of Vital Strategies. That really was a Bloomberg organization that funded a lot of these things on the ground. In his long view newsletter that he publishes regularly, the recent one that he published on LinkedIn, and we've been having a side dialogue with some members of our working group with him, He said that global health, and allow me to read, global health has no shortage of ambition. It has disease strategies, coverage targets, performance dashboards, and technologies that would have seemed impossible a generation ago. Yet it still struggles with the question patients notice first. Do the pieces work together when illness does not arrive alone? Meaning the community contacts, their circumstance, where they're located, their access to care, the information and awareness, which is on the broader side of health, not just healthcare. And he says that technology becomes progress only when it survives the journey from the lab to the clinic to the household and the community. And so he has this notion that, the global health architecture, innovation, and access, they have to be designed together, which comes back to your human-centered design and to reduce this fragmentation. So one of our working group members who is involved in designing systems more from an artistic perspective. That's why we're such a very interesting dynamic working group, bringing these thoughts together.
Okay.
This is how he responded to that. He said, this is a powerful framing of the future of global health. The article makes one thing clear. Fragmentation is not just an operational weakness, it's a human cost. When systems are organized around diseases, funding streams, departments, and indicators, people are forced to navigate care in pieces, even though they live whole lives. The shift towards integrated, people-centered systems is therefore not just a technical improvement, it is a moral and strategic necessity. And for him, as coming from a different perspective, non-health, the strongest point is that integration will not happen through language alone. It requires different incentives, stronger country leadership, which you mentioned, better coordination, which you mentioned, and the meaningful involvement of communities, health workers, civil societies, and patients in shaping the architecture of care. Meaning that the future of global health then will depend on whether systems can move from managing programs to serving people. And if we use the African context as an example, I just want to get a response to all of that from you as we bring Dr. Mable on stage.
Okay, so that's quite a lot to get a response.
It is, yes.
So I would say, in response to that, from what you've talked about and raised, you raised fragmentation, which is a cost. And when you look at the sunk cost of fragmentation of systems, people forget that in the everyday work life of the healthcare community worker, you're losing on that level, right? In terms of labor that is sunk and not really adding value. In terms of systems and in terms of commuting and extra housekeeping from the patient point of view, there's an opportunity cost as well. And then when you now look at the systems and you talk about I think he mentioned all the solutions are there and all the technologies, innovations.
Yeah.
And everything. I think because once upon a time, I used to do quite a lot of portfolio management and managing projects and heading up a PMO. And I had to have a very strict rule where you have to look at what solutions are we putting out there, right? So there are two ways I look at it. You have to ask yourself, are you putting out, there are two things that will happen. So let's look at the solution as a human being, for instance. You either need a painkiller or a multivitamin, right? Now, when you need a painkiller, it's more important than a multivitamin because you got to stop the pain. And the multivitamin is a nice to have. The reason I'm bringing that analogy in is that you're looking at a situation where we have so many nice to haves that come in terms of solutions, but our core infrastructure is not at that level to adopt that. And then you get distracted. We have to focus on the painkiller solutions first. Mm-hmm. The painkiller solution is the foundational infrastructure. Mm-hmm. Without having a way on ensuring that we have no matter where we are, we can go digital first. We keep going around in circles, because I spoke to someone some time ago in Nigeria. We're talking about public sector health and some of the EMRs they implemented. And he was telling me confident that yes, they implemented in some of them hospitals, but it's not all the time functional, because sometimes they have the power outage. And when they don't have it, they have to have a workaround. And there's the training of people and everything. So why am I saying this? The key thing here is that all these solutions can work, right? The solutions are there. We focus, there are two separate things. There's the technology, but there's the management. And project management is a discipline that is very important, and execution. Our execution and also the governance around the projects and governance around implementation is very weak. So you may talk and have a sound bite on something that's interesting, but why do we have so many projects we talk about? It's not only in Africa, all over the world, and even in the UK here, we experience that. And it doesn't really go according to plan, or it eventually happens, but it has overrun and this has cost a lot more. So I feel that the key thing here is that as a continent, we should be looking and shadowing each other. Where something has worked to scale and has been implemented, we should borrow the lessons learned, not only the lessons learned, but also the solutions, the framework, the practice, the whole thing, and implement. So now you're paying like a licensing fee to the African country. It saves you a lot of money than you starting afresh, trying to do your own thing. You understand? So what we all should own is our data as source, when I talk about data sovereignty. But more importantly now, we're now able to start seeing similarities, because we're on the same continent, regarding the data output and regarding the sort of way we manage disease and surveillance and everything. So I feel it is, this challenge more is on frameworks, governance, and execution more than anything else. Because yes, we have these solutions, but those in leadership level are not necessarily tasked with choosing the best solution. They are there to move things forward and remove the blockers. What should happen is that you need experts who come in and actually prioritize. You must have a prioritized approach. It's like what we used to call back then in software development. We had a must-cow rule. So M stands for the must, have, should have, could have, and would have. Now, when you prioritize based on that and you put a weighting based on if this goes in, what value does it add? It changes the whole game. And I think what happens is that at that top level, when we're bringing all the solutions, everything is fighting and competing. Nobody says stop here, this here. And dependent on who is passionate about one certain thing more than the other, who has the louder voice or who has the stronger influence, things that are vitamins go ahead of things that are painkillers. So
very good point. Thank you. This is more to discuss. Dr. Mable Kipenda, I'd like to introduce Dr. Mable and get some perspectives from her, another member of the working group, like you, Joel. As you know, Mabel's a medical doctor and a public health expert focused on maternal and child health and adolescent and youth development. And I know she collaborated with you. She's based in Lusaka, Zambia, works across more global, in the UK and elsewhere. And so, Dr. Mable, some thoughts from you.
Yes. Thank you so much, Dr. Thomas. Can you hear me?
Yes, very well.
Okay. Thank you so much, Dr. Thomas, for that warm introduction. And Joel, really great to just recall and listen into the insights that were coming out of the survey. And I was very excited to actually take part in this important work. So I'll just speak a little bit around like what's happening in Zambia at a broader perspective, and then I will delve it down into the grassroots, for example, the health professionals themselves and what they experience, and also echo through the perspectives that we got out of this survey. So to start with, Zambia has made a lot of strides when it comes to digital health technologies, and we've been speaking about this with Joel as well for the longest time, because we know that Zambia has had so much potential when it comes to digital health. For example, we do have, I think, a digital health strategy, which is not really it's not really out there for the public. I haven't seen it personally, but they do referenced it a couple of times. So that just shows that we are really thinking and discussing digital health. And then when it comes to the bigger picture, for example, the Lusaka agenda that really emphasizes on country-led initiatives when it comes to digital health, and that's what Joel elaborated on earlier on. We have the Ministry of Health leading a very important activity, and that's developing a digital health hub. So there's been a lot of conversations that have happened already, and Zambia is at, I think, an advanced stage in really creating a digital hub for the country. And the learnings are coming from Rwanda, because we know that Rwanda has a digital health hub and they're doing so much work around it. So that's just kudos to the country. However, thinking through the perspectives that were coming out from this survey, we do learn that there's a lot of challenges that come out for implementing or working around digital health survey. I'll speak specifically around the infrastructure. For example, here in Zambia, we struggle a lot with internet connectivity, and that's something that was highlighted even from the perspectives that the health providers gave in this survey. So you can see that we really do have challenges in just connecting to internet. You'd find that you have about 3 to 4 different networks that are on standby, just so that you can connect to the next one if one fails you. So you can imagine having those challenges in a hospital setting. We do have smart care, which is like the electronic health records. And this is one of the big things that Zambia thinks that we are doing so well when it comes to digital health. But there's also lots of gaps around, especially reviews from the health professionals themselves. They struggle a lot in terms of using it, applying it into their everyday perspectives. And then when it comes to now just applying digital health technologies, different conversations have come out from health professionals. It's around just not having the literacy and the training around how to navigate some of the specifics around digital health. For example, how do you navigate working with AI chat boxes when you're trying to learn something, and that's very difficult because we've learned even just from the last Zambia Medical Association's conference that we had last year. We learned that there's a very big discrepancy between the senior medical doctors and the junior medical doctors, because we haven't yet embraced AI. The senior doctors have not really embraced AI to that capacity where they are allowing students and junior doctors to use it without any fear. So these young professionals are hiding in using it. We know that they are using it, but they're not using it to its full effect because they are not being guided. Just recently, I was reading a survey that some colleagues did around the policies around the use of AI in the universities in Zambia. And lo and behold, there really are no policies that guide students on how to use digital health, particularly artificial intelligence, effectively. But then you can also see that there's so much opportunity in terms of how we leverage digital health in Zambia, for example, and that cuts across other countries as well, because we do have the gadgets. We do have internet. We're not saying we don't have internet completely. Internet is there. And just a recent conversation with colleagues, we learned that even in the most remote areas, there is some level of digital technology. There's smartphones there's internet connection. It may be a little bit up here and there, but we do learn that there's some levels of internet connectivity there. So now the discussion is, how do we then prepare healthcare providers to work efficiently in this space without them having challenges or just avoiding it completely because of the past experiences they've had with it. And that's why probably we are much more interested in also learning from what other countries across the continent are doing to leverage digital health space. So these conversations are happening. There's a lot of excitement around digital health because it actually has shown that it can actually aid, leverage, or for lack of better terms, it can help build a fragmented health system. We know already that, for example, in Zambia, we do have a lot of challenges in the health system. We have inadequate healthcare providers. We have very few technologies to help assess patients, diagnose them. So we are thinking about how we can leverage digital health to support that. We see there's telemedicine, for example, and telemedicine can even be as easy as a phone conversation with somebody who is far, or leveraging artificial intelligence spaces, leveraging the knowledge that these healthcare providers would have prior to actually thinking about how they can help others in the spaces. But most importantly, it's also the need to bring in the users themselves, the clients, the patients. I think that's a very important aspect, even as we are looking at it, because we know that our primary target as healthcare providers is the patient, and we want the best for that patient. From learning, we know that most of our clients actually Google, or now they chat GTP patient symptoms before they visit a healthcare provider. And that's a fact. They'll come to you like they're talking to you in big terms. They're like, oh my goodness, where did they learn from this? No, ChatGPT taught them. But the question is, are they actually using these spaces effectively to help them? So we need, even as we are trying to provide literacy to the healthcare providers, give them a supportive environment of using digital health, it's important to also learn from the users themselves, our clients, on how best digital health can help them on their end. And at the end of the day, you only make a great diagnosis if you learn the history from your patient very well. And so if the patient has a capacity of leveraging and using digital health technologies in the most appropriate way to help them, guide them to give appropriate an appropriate understanding of how they feel themselves, then that would be easier. It would be easier. And it would also, I'm also thinking how it would also it would sort of like reduce the burden of overload of patients in the healthcare, because, for example, there could be systems that can help triage patients before they even come to a facility, so that you don't have to have so much overload of patients. So opportunities are there. We are seeing so many opportunities, but the big question is, how are we contextualizing it to make sure that the users, both the healthcare providers and the clients themselves, are using it appropriately and effectively, and it's for their benefit? And also, what are we putting in place to make sure that these initiatives that we're bringing in us in an enabling environment? We have spaces where they don't have to struggle so much to actually access the services. So this is what I wanted to share. But I really, it's just really important that we really think through, even as we are throwing this out, but also learning from what's already been done. For example, if something has been done in South Africa, I don't think there's a need for Zambia to do the same learning. We could just grasp what has been done already and contextualize it, just like, exactly, I know Joe is nodding his head because he did mention this point, and I'm just emphasizing it, that there is no need for us to keep learning and trying to see what works, what doesn't work. I think it's important to start mapping out what's already been doing. I would like to end by somebody shared a very interesting perspective on how a healthcare provider in South Africa was on TV a few days ago, explaining how she's leveraging AI to help her colleagues in the rural areas to assess and just manage patients in those spaces. I didn't get the nuggets of it. I tried to Google it and learn, but I didn't actually get it. So I'm looking forward to reading that, so that I learn and see how that can work from my perspective, knowing for sure that I do understand the dynamics of the Zambian system, the Zambian health system. Yeah, so I'd just like to end with this. And thank you so much for this opportunity.
Thank you, Dr. Mable. Stay if you can. I just want to, the important thing with the enabling environment. So the question to you both is, we're a working group, a small working group, but we want to influence more. And you mentioned the Zambia Medical Association. How can what this discussion brings engage medical associations in the way that Dr. Joel mentioned to broaden the perspective for policy action, to say, here are the things, the 3 or 5 things that need to be in place, and how can we work with medical associations across the continent to get them engaged in these perspectives? For both of you, if that's, because the whole notion of the enabling environment is critical.
Sure, I'll go first and then Joe will add on. Yeah, so for ZMA, the Zambia Medical Association, I belong to the medical research, medical education and research board. And like I said, from the previous conference last year, there was a lot of mixed feelings around the use of AI, and that's part of digital health. But we know for sure that we were using a lot of digital gadgets in that space, but you could see that there's a bit of hesitance in incorporating AI, which we all know that it could be a game changer if we just use it correctly and rightly. But the Zambia Medical Association is very much on board. I think what they're looking for at this point is insights, great evidence that we can present to them, we can show, and that's what they want to ride with. So even as they are engaging the members of the association, they do have this evidence. It's like they are coming in with a convincing, compelling point of view that we need to be incorporating these spaces now. At this point, we need to be incorporating digital health, and we need to be incorporating it effectively and efficiently. So from the healthcare perspectives, I think the need is that the Zambia Medical Association needs to have the right tools to help improve the literacy and training amongst healthcare providers. That's one thing. The second thing is also to learn from both the healthcare providers and the clients on how best we can contextualize these tools, so that at the end of the day, we are seeing improved healthcare through leveraging digital health technology. So I'll pause here and then I'll throw it to Joel if he has any thoughts.
Joel, thoughts on this?
Yeah, thank you. Yeah, well covered, Mable, Dr. Mable. Thanks for that. I think 2 things I want to touch on, because you talked about AI being used by, you were going to research more on that example you talked about in South Africa. Now, shadow AI is a major issue, right? So even when we look at non-medical sector, right, we just look at AI generally, people using ChatGPT, Claude, whatever, taking sensitive company information, plugging it in there, working on it. Now, from that perspective, we have to really address shadow AI within the health sector, because it's hugely dangerous. Because
what do you mean, shadow AI? What's that?
Shadow AI is when the AI tool being used in an organization has not been mandated by the organization and rolled out officially. So, for instance, you're doing your work and then you're now opening another screen and using ChatGPT to take your work thing and put in ChatGPT and then bring it back into your work. Now, what most organizations and where the associations can make a difference is, the key thing with AI is that we're taking AI solutions from outside the continent and trying to apply it in our continent, but it loses its context. Why? Because it wasn't trained on our data. Now, to train on our data, we do not have a digital first approach, one. Secondly, we do not have the amount of data. People underestimate the amount of data required to properly train AI to achieve what has been achieved. If you look at the speed of ChatGPT, part of the reason they did the free model was to get millions and millions of people putting in data. So if you used it when it came out in 2022, 2023 till now, it's a lot different. If you remember back in the day, LinkedIn actually pushed something on where they would ask experts to put in their information and answer questions that were strategic, right? They would say, what is your view on that? I participated quite a bit because I was always getting the prompts and being invited because I write on LinkedIn. That is the way they trained it, and they've stopped it. They were giving us badges and all those things. So imagine how many people put information there. Now, let's look at it in our context in Africa. If we have our associations and the associations do not have a way in which the Zambian can work with the Nigerian, with the South African, with the Uganda on a common thing, you see, we're all doing our different things. We're all doing our different pilots. I will suggest that as a way forward for the continent, we should have major programs where there's focus based on prioritization that this is important across every country in Africa. And this is how we feed into that main program, and it's pulling us forward. We don't have that. I feel that the associations are best placed to do that because, first of all, there's less, obviously they have to change their structure a bit because they have to make out time from their normal 9 to 5 to run this program. So there has to be some incentive to really recognize the good work they're doing to put in there. They are also the people who could come with the governance and all those things and policies and critique it, make it strong, and then push it through government via advocacy and via other kind of conferences we run to push things forward. So my whole pet peeve when I look at all these conferences and we're chill speaking in most of them is that we have the same topics, we talk, but we do not really do because there's no structured way of doing. And when we do, we're making progress in silos or per country, but it will never be enough to get that scale. So in my view, to answer the question, Dr. Yonette, what you said, I feel that the first thing is that how do we ensure that there are standardized things that are across the board, everybody is sharing, that we can work in a center of excellence that brings information. Like, for instance, if we standardize certain things on the fire or on the DARCOM, how do we do it? Imagine a situation where if someone goes to go and do a image x-ray, and now you go to another person in Africa and you want to do x-ray, they're charging you again, even if you did one 2 weeks ago, but that x-ray is still valid maybe. Right? Mm-hmm. So why don't we have a system? And that's something that SenHealth is working on, where when we have actually tagged it in such a way that if you go somewhere else, you don't have to repeat that particular exact x-ray, and the clinician should be confident enough to use that to move forward. What are you doing? Yeah. 2 things you're saving for the person. The other thing, we're actually building on our data. We're actually training. So there's quite a lot that can be done. I feel the issue is in strategy of execution. We talk, but we don't have a technology strategy. We don't have an execution and project management discipline. And so even within areas where you're not project managers and you're subject matter experts, you have to bring that discipline. And then we have to hold ourselves accountable on a time frame. Because our time is fluid, we talk and then things don't happen. We keep moving the goalposts. If you remember, we had the SDG goals. We do this, do that.
Right.
2030. Right. Each keeps moving out. Now we're saying 2052. Yeah. What joke is that? You know? Yes. So I think moving fast, that there are things we can do. We have to really be disciplined and intentional about it.
So I think one of the things that can come out of this, and as a working group, as members of clusters within the working group, we're seeking points of progress and points that can influence policy action, not just policy action. And I'm going to challenge you and Dr. Mable and include Dr. Imizudayo in this, that we develop a policy brief that outlines these perspectives that you raise, what needs to be in place, and how medical associations and other disciplinary associations, because this has to be a multidisciplinary effort. It's not, medicine is not just an end in itself, because it treats the individual, the family, the community, and the society. And so we have to bring in other disciplines, but I think we should do a policy brief that outlines these items that need to be in place, because the pieces are there. Going back to Jose Luis's perspective, and I'm sure he would love to participate given his role at WHO, the pieces are there. But as you're saying, Joel, the discipline has to be in place so that there's comparability, there's an integration across the board, and it has to be I hate to use the word political will, but it has to be part of the political will that this
That's
is
the
how we're going
underlying
to
thing.
achieve, right? This is how we're going to achieve that. And maybe a policy brief like this would get the attention of the Africa CDC and other entities that we're attempting to target. So I think this is a good spirited discussion. We have a few minutes, another 5 minutes left. I see whoever is left in the audience. I know we lost some folks. I don't know if they'd like to join us and raise a question or offer a comment before we wrap up.
You mentioned Dr. Imesidayo.
Yes, she's in clinic. She's listening in. This is
Okay.
the time zone
So
issue.
decided to bring her in.
Yeah,
Okay.
I don't know if she's able to join. And we can ask Joseph Bukanjo, our technical guy in the background, to see if we can add folks who may want to add a comment or say something. We'll give them a few seconds. While we do that, any other particular thoughts that, let's see, there's Wendy. Wendy, thanks for joining. Do you, a comment, a thought, given the discussion this morning? We want to bring this out into a multidisciplinary perspective so that we can...
Sure.
Yes.
Yeah, it was such a rich discussion. Thank you very much. I'm just coming off the back of spending all day yesterday in a conference which was talking about how do we lead a human and a non-human workforce, just recognizing, the incredible pace of digital transformation, the role of AI, and all of that. So this has just been so timely. You made some really important points about how leadership are able to absorb and plan for these things, and also I'm in higher education over at the Rutgers School of Public Health, how those of us in education should be enabling the current and future generation of the workforce. I thought that was really interesting. The thing that really struck me, and it's very much Yonette's point about what next, is really that argument, I think, that we make health the argument for advancing technological transformation, and the powerful kind of productivity, access, well-being, quality of life, all of the things that fall from that. But actually using that argument is really powerful if we're to make progress in the way that you're describing. So really just to underline Yonette's point about drawing all of this into a report that makes that argument really powerfully. And I think we've seen that health argument used in other spaces around sustainability or others, but I think it was such a powerful call to action. That's what I'm taking away. And I really appreciate your time. So thank you very much.
Thank you so much for those insights, Wendy. They do matter because, we want the perspectives, we don't want to be siloed. We want to, because they're so powerful and so important. And we seem to, as Jose Luis points out, we keep talking about this, but how do we really, what are some of the levers, the small levers and the large levers that we can push to kind of, change the envelope? And I think this initial survey done by you, Joe, led by you, and in collaboration with Mable, could be an instrumental. So let's keep on this. This is the whole point of this working group and our clusters within the working group. Do not be disheartened that there are not that many people on this listening in on this active session. What we're seeing is last session we had 300 people go back and listen. So there's impact. So we just keep doing what we're doing because it's important. So I want to thank you, Joel, for being persistent and leading the way, doing this survey, making this presentation. Mable, for your insights and your continued work in this area. Wendy, for your insights. Dr. Imesidayo, thank you for listening in. I hope your trainees are also listening in. And we are going to bring the session to a close today. But, Joel and Mable, that I will be persistent in the background saying, okay, so what's the policy brief? What's the next steps? So you'll be hearing from me further on this so that we can develop something that pushes this to the next level. Okay. Thank you all. Thank you very much. And with that, I would like to bring today's seminar to a close, and join us next week for next week's seminar. Okay. Thank you. Be well. Take care.
Thank you.
Thank you.